The challenges that are going to be facing healthcare in the coming years, say 3 to 5 years, um, are, I think there's a few levels of challenges. There's been a focus over some years now of making the patient health information electronic through implementation of electronic health record or electronic medical record. And that's still progressing, and I think that will continue to evolve. That's sort of step zero as far as I'm concerned. Um, we at the Ottawa hospital where I work, I chose to take a very aggressive position in terms of our mobility enablement. So we have in the dimension of 3,000 iPads implemented to all our physicians, residents, and other caregivers, so that the information that's available electronic is with them. It's current, and it's there when they need it, and probably most importantly, it allows them to deliver care at the patient bedside, as opposed to being tethered to a PC that's, some, distance down the hallway. So that's a fundamental change. Once you've implemented mobility, which, as I said, we did quite aggressively, but I think everyone will have to face mobility at some point in time. What we're now shifting our focus to is using mobility as an enabler to standardize processes in healthcare. So we've invested in the IBM suite of business process management tools, and we're now modeling processes. But the important point about modeling the processes is healthcare has sort of grown up and is still very provider focused. The patients are sort of a entity that move through the provider focused processes. What we're trying to do is shift that so that we're defining the processes, but in terms of movement of the patient. So it starts when they, for instance, present themselves at the emergency department, follows every step and intervention, and there can be dozens of caregivers involved in the care, right to when they're discharged, and even beyond that, to make sure that they have the resources that they need to sustain themselves at home or wherever they're going back to. So I think that's enough work for the next few years, and I believe those are the challenges.